Hello and welcome to the Real Hernando, presented to you by Thrive Entertainment and produced by SRP Studios Podcasting. This podcast spotlights Hernando, Mississippi's businesses, organizations, and community leaders and surrounding businesses in DeSoto County. You can find the show on Apple, Spotify, YouTube, Facebook, Instagram, and TikTok. Today, we are spotlighting Angela Kidd and Angela Kidd Insurance. They specialize in Medicare, health insurance, and life insurance, helping individuals and families find coverage that truly fits their needs. They understand that shopping for insurance can feel overwhelming, 100% there, which is why their mission is to simplify the process and provide clear, informed guidance every step of the way. Every client is treated with the same care and respect as family, ensuring the right protection is in place for you and your loved ones. With years of experience and a commitment to personalized service, Angela Kidd Insurance offers free consultations to help you confidently plan for a secure future without the stress. For more information, visit angelakiddinsurance.com, Kidd with two Ds, Angela, Kidd, insurance.com. And without further ado, my good friend Angela Kidd. Cue the applause button, please.
Thank you. How
are you, Miss Angela?
I am doing great, Derek. How are you?
I'm great. Good to have you back. You're one of the few that now have seen every location I've been in.
Yeah.
You've been around for a long time. We are BNIers, fellow BNIers, friends.
Yep.
You have been on a previous podcast I used to do called Cafe and Commerce.
Yep.
And then now that this podcast is ramping back up, I'm like, I got to get my friend Angela back on. Let's do this.
I appreciate it. It's awesome.
Yeah. So, goodness, because insurance can be just a cluster. Even when you have it and you need to use it, it gets weird. I know from experience, but you're coming in today from Southaven. Now, I believe the last time we had you on the show, did you have your office yet? I cannot remember, because now you have a brick and mortar.
I do. I actually have a brick and mortar.
Is it the same spot that I've been to?
Yes.
Okay, so that is 8830 Center Street, Suite 1, Southaven, Mississippi, which is just off of State Line.
Yep, State Line Airways area.
State Line Airways. Yeah, beautiful office in there.
Yep. Been there 2 years now. So
2 years?
It was maybe right around the time that we did that first one.
Must be, yeah.
Right before it.
Yeah.
So, yep, been there for 2 years now.
And who's the lovely lady that works with you over there?
Kelly. Yep. She is my right hand.
Yes.
And been with me for almost 2 years. Yep.
Yeah, since the beginning, really, of the brick and mortar.
Yeah, she started in August. So come August, it'll be 2 years.
And then prior to that, working out of home, obviously.
Yeah.
So how long? How long have you been in business now as Angela Kidd Insurance?
Right at 4 years. Actually, right at 4 years. May makes 4 years.
Oh, look at that. We didn't even plan this.
May makes 4 years.
All right. Well, congratulations.
Thank you.
God, I mean, I know how tough it is. A lot of the small business owners know how tough that is. But has opening an office helped grow?
It has.
Has it been a positive?
I would absolutely say yes, because having that actual brick and mortar is giving it more of a legitimate feel, especially for a lot of folks. Especially when working with seniors, because they like knowing that they've got someone that they can go and sit down with and sit across the table from and have that conversation.
Yes.
And I still have those folks that I still go to their homes, different situations. So we still have that in person. Or if we need to do it over the phone, if they're really far away, we do that too.
You've just opened up a new option for your clients and customers. Yeah. Yeah, because I just recently switched to our friend Brandon Vandenberg at Shelter Insurance for my auto for the same reason. Like, I want to be able to sit in front of someone because it can get convoluted. But nothing more than, auto insurance is what it is, but health insurance, my goodness, because it changes constantly, right?
Constantly.
So what are, I don't even know where to begin. Let's just start from the basics. So tell us what you offer. I just laid out Medicare, health, and life.
Mm-hmm.
Of those three, which one do you feel you're involved with the most?
Medicare.
Okay.
So Medicare and all the retirement planning that comes with that is our specialty. That's where we specialize. That's where I began, and that's my passion. With that, it's because our seniors are so taken advantage of. Mm-hmm. So with everything that is all health insurance, there's always changes, especially with Medicare. As the government makes changes to things, so do the insurance companies.
Yeah. Because subsidies change, right? In my world, at least.
Yeah, in the healthcare.gov world, and those under 65 plans, those plans, that Affordable Care Act plans, those, we just got news yesterday that one of the main carriers of those plans in this area is not going to be available next year.
Please don't tell me it's Ambetter.
It's not Ambetter.
Okay.
Not right now. It is not. Cigna just released yesterday, as of end of April, that they are not going to have plans in 2027.
That's a big one too, isn't it?
Yep.
Oh man.
Yeah, it's all over the U.S. Like they're just not going to have. They're going off of the marketplace. We're like, oh.
So everyone watching and listening, if that just made you super anxious and stressed out,
give us a call.
give Angela a call at 662-339-8133. Yep, everyone, because she can help you with this stuff.
And in November, you will need to change your plan.
Oh man.
Yep.
And the fall always creeps up on you, doesn't it?
It does, and it'll be here before we turn around.
Because of, collaborating with you and just being a BNI with you for a few years now. Like CPAs have their tax season, but what you do, you have your season as well, where things become crunch time, right? Because when is it typically you have to sign on for your next plan? Is it October?
It is. So whether you are Medicare or you're in the under 65 trying to navigate the Affordable Care Act plans, those healthcare.gov plans, the Obamacare, for lack of a better term for them. But no matter what enrollments you're navigating, it all happens in the fall. It goes around different time periods. Medicare starts in October. The under 65 is November 1st. So one starts October 15th and goes to December 7th, which is the Medicare, in which that is the time of year that folks that are on Medicare can review their prescription drug plans or their Medicare Advantage plans and make changes to either one of those. Then the healthcare.gov plans, they start November 1st and go to December 15th.
Yeah. See.
Yeah.
I already forgot everything you just said. And that's why we need you.
October and November, that's annual enrollment.
Yeah. But that's what you do, right? I mean, you're there to remember that for your people, right? And to
remind them of it.
And also, so now you're sitting down with someone and you're helping them pick a specific plan that fits them best. Income matters, right? What kind of income they're earning. I know for what I'm a part of the Affordable Care Act.
Yep.
I have Obamacare and it has been good for me being a self-employed podcaster, musician, but all my life I've been an entrepreneur, So there was a period where I never had insurance. I just had to kind of ride it out. So it's helped me in ways for sure, but I know it's at the cost of other things. That's a whole other discussion. So what made you even want to get into this field? Anyway, to begin with.
So go back to 2017. In 2017, I was working for a local church. I was in one of their admins, and they restructured. And restructured me right out of the office. I went, okay.
That's a nice way to put it. Yeah.
It was. They restructured their office. They really did. They restructured 2 admins and a pastor all out. So when they restructured, I was like, okay, what am I going to do? So looking for a new job. My husband was actually starting his Medicare journey that fall. So I was like, okay, the only job that I'd actually looked at and applied for was running a Medicare supplement agency locally. I was an agent that had his business in his home for 15 years and was turning 65 and had wanted to be able to take a step back. That's really hard to do when you have your own business and it's in your home.
For sure, yeah.
So he had opened a brick and mortar. I joined the team as his office manager and was actually the office manager of that agency until I stepped out on my own. But that was after he sold it. In 21, he sold the agency. But it was the perfect opportunity because I needed to learn Medicare because my husband was just going to start his journey. And he was 42. Like, I wasn't even 40 yet. And here I am, fixing to have to try to figure out, navigate Medicare for my own spouse. So this was the perfect opportunity to learn how to do that.
So they gave you all the education.
So I ran that agency. I was the office manager there for 4 years and 5 years, 17 to 21 or 22.
4-ish,
yeah.
4 or 5 years.
Yeah, about 5 years there, ran that agency as the office manager. So I was the one that was learning how to fix all the problems and handle all the issues and navigate all of that is with the traditional Medicare, with the supplements and the drug plans and all the pieces that fall in there. So that's where I got my base. So I learned now I have both that side and I can help you walk through it. We've walked through both sides of Medicare now with my spouse. So, but it was originally because I had to figure it out for my spouse, and God puts us where we're supposed to be.
And I don't think the question is, when are you fighting a fire? It's how many fires at once, right? Like, it must be constant.
Well, if someone gets it, if they're in the correct plans for them, then not necessarily. If it's done right on the front end, then there's not as many fires that have to be handled on the back end. And that's where it is important to get it right on the front end so we don't have those fires on the back end.
And let me tie into this with a story. I may have mentioned this to you way back when it happened, but now you can definitely help. I want to educate the audience on what to be careful with, because this is something that happened to me that was quite shocking and was not expected. But as I mentioned, I have subsidized insurance. And I had a few really good years. You know where this is going, right?
I do.
And it was I talked to my accountant in January of 23. So it was for the year of 2022. That was a really good peak year for me. And he's like, I got some bad news for you. And I'm like, okay. He's like, you've earned too much and you owe all of your subsidies, which was $5,000, and they're pinging you in the taxes right now. So now your taxes have gone up $5,000 is basically what it was. Woo! Wasn't expecting that. Now, if I would have had someone like you by my side, would you have been gauging that along the way and been like, hey, we got to be careful.
Yes.
We need to refigure this. So explain what happened and how that was avoidable for me.
So with the healthcare.gov plans, especially because they are based off of income. And as part of that application, when someone's doing that, you have to put in all of that income information. And anytime anybody has any changes in that can be updated throughout the year to keep that more in line. But that is where from year to year, all of that does need to be updated. And now they've actually made that a requirement. That's some of the things that have changed within that part, is that going from last year to this year, because so many people had been enrolled in some of the $0 plans that existed without even knowing they were in insurance until they're getting pinged for stuff on their taxes. And to try to combat that this past year, if someone did not go through and actually update their applications, they very well could have gotten rolled over into either premiums that weren't correct, just a lot of things, bad plans get canceled, all kind of things. So they made it where people pretty much had to, or they were paying for it. So that's what we helped people avoid, because we actually go back through and make sure all of your income information is still correct. And I let my people know, hey, if you have any changes throughout the year, call me, let me know. It's better to update it now than have to repay that. Because if that changes now and there's any differences now, depending on how much of a difference, they're making people repay the entire subsidy, not just a percentage of it.
Yeah. And that's not a good phone call to get from your accountant. I promise you.
Not at all. Because, I mean, that can be, because especially if people are getting $1,000 a month. Like, you can have to pay back $12,000 on stuff. So, I mean, like, people are getting hit with large bills. And will be even worse next year.
Which, again, is why you need Angela on your team here. We need her. You need her on your side because you could save you from these headaches, and you're getting educated as you go. Thankfully / unfortunately, I don't know which way to go, but I haven't had that problem since, Angela. We'll just say I've not, had that problem.
Good.
We had to pay back anything. So it's a good thing, bad thing. I don't know. We'll figure that out later. But
yeah.
All right. So for someone that has no idea where to start, what are the first few steps they can take? Of course, you call Angela first.
Yep.
But from there, someone's like, I don't know what we could be talking about. The elders looking for Medicaid or Medicare. What is it?
Care.
Medicare. I always confuse the two.
That's a good place.
Regardless, someone's needing health insurance now for whatever many reasons. Where do they start?
Well, you give us a call. 662-339-8133. But with that, no matter where they are in that journey, we can answer their questions. So give us a call. We can at least help them guide down that path. But if they're starting their Medicare journey, depending on if they're still working, if they're turning 65, just depending on where they are in all of that, depends on what they need to do. Say there's someone that's turning 65, going over to Medicare. They are already drawing their Social Security benefits. Then they're should be auto enrolled into Medicare. And so should be.
So that means not all the time it works the way it's supposed to work.
Oh, not all the time it works the way
right.
Nothing ever does 100% of the time. There's sometimes that perfect storm of things that happen that cause little issues, and it happens, especially with the government and dealing with two different departments within the government. It gets interesting, and because left hand doesn't always talk to right hand.
Ain't that the truth? Yes.
So you deal with Social Security because people think, oh, I sign up for Medicare, I call Medicare. You actually don't. You call Social Security.
Right.
So, Social Security has now made, if you've never created a login for SSA.gov, please go there and do that. Because it's better to do that now, and make sure you keep your password information.
So that at any age you can set this up. At any
age you can set that up.
So you're suggesting anyone go set that up now?
Exactly. Okay. But make sure you keep that password information because you will need to be able to get into it. Yeah. But because if you do it when you're younger, one, you'll have all that ID verified. And one of the things that US ID or ID Me, several different ways that you can do that. That's actually the login that they use for several different places. But you can also track your Social Security to make sure Social Security is actually reflecting your income accurately. So when taxes are being filed, the correct things are on there. And you can see, one, that is where everything is done with Medicare. But if you go ahead and have that at an earlier age, even, it allows you to be able to see that stuff. Yeah. And you'll get those Social Security statements so you know if something happens and you become disabled, how much money you'll earn. So that's a big thing. But that is the place where we go to apply for the Medicare. For Medicare Part A, for Part B, if we're enrolling in one, delaying one, just depending on what somebody's situation is, what that requires. We do all of that through that Medicare.gov. Or through SSA.gov. And with the Social Security, since they've increased security on Social Security's website, because it got hacked a couple of years ago, they have now, you have to take a picture of your ID, you have to take a picture of the front and back of your ID, and take a selfie. And honestly, that's easier for some to do younger. So if you go ahead and have that done, then it makes it, because it is, this whole new increased security is not really appreciated. Really? A whole lot of our elders, at least not the process of it, because
they appreciate the security, but it's the route to get that security that is frustrating.
Because it's complicated, and it doesn't always verify their identity based off of their picture and their selfie, and it's a whole thing. Then they have to go to the Social Security office. It's just adding a whole nother layer. Although it did allow us to figure out one time that somebody's ID had actually expired. They didn't realize their driver's license had expired on their birthday.
Oh, that happened to me. Oh, side note, because you'll think this is hilarious. I found out my license was expired from our friend Brandon at Shelter Insurance. When I was switching insurances, he's like, screenshot your license and send it to me. And he's like, did you know your license is expired? I'm like, I did not. No, I did not know this.
I did not.
So I wouldn't fix that. Thanks, Brandon. Shout out to Brandon at Shelter Insurance. Good guy over there in Monteith. Yeah. So right there, though, again, there's so much to think about. Like that just made my brain hurt thinking of hearing all of that information.
And that's part of that you come into the office and I help you through all of that. Like if somebody's never set that up and they're having trouble with that, or they just don't even know where to start, that they've only got their cell phone, which you can do it all on your cell phone these days, because it's just a little computer in our hands. But they can come in and I can help them take pictures of their license. I can help them do all of that from the beginning all the way through. So thus, no matter where they are, we help with that process.
Good deal.
Yeah.
So again, call 662-339-8133. I mean, that's the one-stop shop right there. Do we miss anything on the first few steps?
Well, the first step would just be give us a call and we can help you in the right direction.
There you go. That's the most important.
That's the most important.
Can you share a real story where you helped someone find the right coverage and what that meant for them?
Absolutely. We have people all the time that come in. More recently, right after the first of the year, someone had spoke with another agent during the fall. And somebody that had called them on the phone, unsolicited, which is illegal, but they answered a phone call. They got into a plan that none of their doctors accept. None of their doctors accept.
I have a story with that too, but continue, please.
And so then here they are at the first of the year, and they're trying to go to their doctor, and their doctor's going, "Oh, we're not in network that plan." And so then they started calling around to some of their other doctors, and none of them. And they saw a lot of specialists, and none of them were in the plan. So they were like, oh my goodness, we're panicking. Well, with Medicare Advantage plans, with those specifically, at the first of the year, from January 1st to end of March, Medicare allows folks to change those plans and right what might have gotten wronged during the fall.
Okay.
So we were able to get this person in and get them into a plan that actually fit their needs. It had a smaller out-of-pocket. It could completely change things for them. They went from being going to have just tremendously amounts of out-of-pocket to next to hardly anything, because all their doctors were in network. They're not going to have all these out of network charges, and they're actually be able to go to see their doctors.
Yeah.
So that would be one instances just with the Medicare Advantage plans more recently. That's a great story though, because I've been in a situation where I was referred to a place and they said yes. And then I'm trying to keep this as vague as possible. I'm trying to throw anyone under the bus, but then the specialist that I was sent to said, "Yeah, we take your insurance." But this was I don't want to say at the beginning of Obamacare, but it was earlier, where they did take my insurance, Blue Cross at the time, but not my level. Does that make sense? Yep. So they didn't take my insurance, and I found out after getting care. Yeah, and several $1,000s later. And that's even a piece. It was awful when I saw that none of that was getting covered.
here's the thing, I called my insurance. They blamed me. I called the person that gave me the initial referral. That's on me. That's on you, Derek. And then I called the specialist that I went to. No, it's your responsibility, Derek. And no one wanted to take credit for any of it.
Yep.
It all went back to me. So be careful out there. Make sure if a doctor says, yeah, they're in your network and they're sending you to a specialist, call that specialist, call your insurance, double check all of it.
Yep. And that's part of what we do.
Yeah.
Especially with that side of Medicare, because constantly things are changing, and it can't even change, because that is the issue with networks like that, is that doctors can go in and out of network at any time.
Down the hall. Like your primary care could be on but then they send you down the hall for the X-ray.
The same building.
The same building, literally.
The same building.
And you think, well, that image person or the X-ray, no, not in network. So you're like, why did I get a bill for the X-ray? I thought I was in network. I was at my doctor's office, and no,
it's completely billed
wacky.
separate. Yeah, it is crazy. We've been dealing with that. We had a lady that relocated from Mississippi to Tennessee to a senior living facility, trying to find all of her doctors and the doctor that actually comes to the senior living place, to the physical therapy people that come to the senior living place that aren't local, and trying to track them down to find out, hey, are you in with any of the Medicare Advantage plans, to only be told, oh, no, we only take traditional Medicare.
Yeah.
And then we finally get an answer that, yes, they are in network. They do take. And I was like, why did they tell us? So even depending on, so not only do we double check it, we usually have the people that we're working with also, hey, you as the patient can sometimes get in faster than we can. So just depending on if we can't, hey, can you call these people and find out? But we usually try to get confirmation of that, whether somebody's in network or not.
Yeah. Because
those things make big changes for folks.
Huge.
I
mean, thousands of dollars. In the medical world, we all know this. You don't just get a bill that's an oops bill for $50. It's thousands of dollars. It's a make or break you type of situation where, in my situation, I'm just gonna be honest with you, that place that tried to charge me $10,000 didn't get a penny of that. Sorry. Where am I going to get it from?
Exactly.
It behooves everyone to get everything straight, right? Like, it would have been beneficial for them to do enough research to say, sorry, Derek,
your level is not accepted here.
We do not accept you.
And sometimes they don't even know that until it gets like layers in. It's crazy sometimes. But that is part of what we help navigate. Even if somebody gets bills in, especially on our Medicare side, if they get bills in, hey, send us a screenshot of it, send us a picture of it, let us look into it, make sure, because that's part of our service is we even look into claims.
Good deal.
I've done 3-way calls with the hospital trying to get claims sorted out and all kind of stuff. So it's a full service.
I will say, because if anyone paying attention, by now, I've said it ad nauseum that I broke my leg last year. Insurance was okay. It was. No, I'll save that story for another day. It still came with some stress, but we take care of it. Well, no, we're here talking insurance. I will share the story with you. So, I go to Campbell Clinic. They're not the enemy in this. So I'm not going to talk bad about anyone, but Campbell Clinic, they were amazing. The Surgeon Ryder, thank you, sir. You did a very good job. But went through the motions, booked the surgery at the Campbell Clinic Surgery Center, only to find out that my insurance covered everything up to the surgery. Like, Campbell Clinic was in the network until you get to the surgery part. Hello, that's kind of the most important part, right?
What?
Yeah. So I'm like, okay. So we had to, and this is something that is common, all of the Campbell Clinic surgeons are at the Med over in Memphis, Region 1, or is it Regional 1? Region 1.
Yeah.
Or
Region 1.
The Med.
The Med.
The trauma center, the main trauma center for hundreds of miles. They come here to Memphis. When you see a helicopter going to the hospital, that's where they're going, put it that way. So I had to go to the emergency room like just and admit myself as like it was an emergency. And then I was able to then through that connect with my Camel Clinic surgeon, and it was a whole thing. I had to jump through all these hoops because once you admitted to the emergency room, the insurance company has to cover it, right?
Yeah.
So that was the loophole. It was just weird. It all worked out. It all worked out, but it still boggles my mind that
weird.
The insurance company was like, okay, we'll cover your x-rays, we'll cover your CAT scan, we'll cover, all the preliminary things, but you're just crap out of luck when it comes time to actually fixing the problem. It's like, oh, all right.
Okay.
Yeah. That was interesting. It was a stressful surgery.
That makes zero sense.
Yeah.
But okay, insurance is weird.
It is weird.
Especially when we're talking the under 65 with those plans, they really are because they've had a lot of changes and they're just weird, and they're going to get even weirder this year. The fall's going to be fun.
So the moral of the story is, again, to work with Angela. She saved you a lot of headaches.
Well, and that is one thing that with the chaos that the healthcare.gov plans are, that we have other options that are not on the marketplace now. Mm-hmm. So that is where we're helping any way that we can with folks now.
Yeah, good, because it's needed out there. Moving targets, right? It's like always a moving target.
It is.
Just when you feel like you're locked in on something changes.
Yep.
And I'm not a reader. I don't pay attention to these things. Like if I get an email on something, I'm just assuming it's junk and I throw it in the trash, right?
Mm-hmm.
So with so many plan options out there, how do you personally guide someone? This might be something we already kind of touched on, but, when you sit with someone, what are some of the ways that you find out and you get to the bottom of what that person actually needs?
We go through a needs analysis.
Okay.
Yeah. We have questions. We have a list of questions that we go through just asking, what their current health insurance is like. Do they have dental insurance? Do they have vision? Is that something that's important to them that they want to carry through? What their health history is, we need to know if they're going through something health wise, or if they have recently. Things like that make a difference. So we go through those questions and ask, do they, especially when we're dealing with the Medicare age folks, do they have any family history of cancer? Well, that's an important thing to ask anybody, but cancer, heart attack, and stroke, any experience with the skilled nursing and, all of that comes in those later stages in life, because those are the questions that are important to know what their needs are. Mm-hmm. Because if we get all of those questions answered, then we'll know how to fill those holes. And
they might have needs they don't realize yet.
Mm-hmm.
Because you're going to come up with the questions about, hey,
yep.
And there's forward thinking too, right? Mm-hmm. You got to plan for the future, plan ahead, right?
Yep, exactly.
For things that might occur.
Mm-hmm.
Yeah, because like you never know when an accident happens.
Exactly.
And
that's where there's even accident insurance. So if you fall and break a leg, there's insurance that can help cover in the case of an accident.
Yeah. Like a supplemental insurance.
Yep.
Like an Aflac type of thing, or
there's stuff like that. There's from that'll cover. Yeah, it's just an accident policy. That's one of the things that that's newer in our little repertoire that we're starting to offer some of those non-marketplace plans that we can layer in. So
we'll call it the cannonball plan. The cannonball plan.
There you go.
When you're just cannonballing life. And you're taking those chances. You never know when you're going to hit the floor of the pool.
Isn't that the truth?
So what's at stake if someone gets this wrong? And on the flip side, how does having the right coverage change someone's peace of mind in the future? Again, something else we've just touched on in a way. But yes, it goes back to you not knowing what you're doing. You're signing the wrong thing. And you've done something where now you said there's a period of time where you can make corrections, right?
Yeah. Well, and some of the things that you can't undo are enrollment penalties, especially when it comes to Medicare, because if people miss their enrollment times, then they can end up with lifetime penalties. So there are certain things that can't be undone. So that's why it's, I had asked somebody the other day, what would be the time for somebody to start talking about their Medicare journey and looking forward to that? It was a lady that's getting ready to retire. She's actually already over 65. She's about 67. And she said, 60? She said, I wish I knew half the stuff that I know now back then so I could be preparing for it.
Yeah.
So, and I suggest, like, if they're starting to look at retirement at 62, hey, let's start talking, because some of the things that can be applied when they start their Medicare journey, if they're starting at 65, go back to when they were 62, 63. So some of those things start hitting there that can be penalties that are added later.
They'll get you.
Yeah, because some of those are income penalties, but there's enrollment time penalties that are lifetime penalties. And if they don't get those things right on the front end, then that is lifetime penalties.
They'll come back to haunt you.
Yeah.
Yeah.
The drugs Part D, is a lifetime penalty that can add up. I've seen people have 150% penalty on those, but they've gone 15 years without coverage and now needing it. Because a lot of folks think, oh, well, I don't need drug coverage. I don't take any medicines. Why would I need that coverage?
Yeah.
Well, right now, there are 3 plans that have a $0 premium. Like, there's no reason not to have that coverage that'll satisfy that in the event that you need it in their future.
Right.
So there's, in which the drug plans all go through Medicare. That was one of the big changes that has come down through when the Part D plans, those prescription drug plans within Medicare, put a max out of pocket on them, because now it's $2,100 is the most somebody can be responsible for prescription drugs, which on Medicare was a big change because there used to be no limit of what somebody was responsible for. So that's been a big change. But when that happened, the companies looked, oh, how can we save money? Their first thing to go were commissions to insurance agents. So everything with the prescription drug plans just goes straight through Medicare now. There's a lot of agents that are not even touching that anymore. They're not even helping with it. They're just telling people, oh, you have to call Medicare. We still do that because it goes along with your Medicare. Whether your drug coverage is within the Advantage plan or it's a separate plan, that's just part of it. So we help people with that too. But if they don't get it right on the front end, it's a penalty.
Each time, yeah.
For every month that they went without coverage.
Man. Yeah.
So avoiding those penalties is one of the biggest things that can't be undone.
If you guys aren't running to your phone right now and calling 662-339-8133, come on. I'm telling you, you got to start planning for the future in those ways.
Yeah. And just to be able to avoid those penalties that can be lifetime.
So we've covered a lot of Medicare and more general healthcare questions from me, but we haven't touched life yet. So tell us more about your life insurance procedure plan and what you offer.
All right. So on the life side, we do more of the final expense, helping plan out those final needs there with those type of policies. But on the life side also falls some of the policies like long-term care and things like that, and recovery care, cancer insurance, heart attack and stroke coverages, that falls on the life side as well. So making sure, because those also can work kind of like life insurance because they can pay out to a beneficiary. So we do all of that depending on what someone's needs are. Depends on what kind of coverages. But with some of those, like the cancer and the heart attack, stroke, and the recovery care, somebody has to go into a skilled nursing facility. Sometimes people would rather have that recovery at home versus in a facility. So this is something that can help coverage in that place.
Would that be hospice? Working with hospice?
Not hospice. Hospice is a different thing. This is like if you're, if someone is injured, instead of having to go into a skilled nursing facility, like into a facility, they can have home care and have a that therapy and things come into the home.
Because hospice is really specific to end of life, right?
Correct.
Different animal,
Yeah, and hospice is treated a whole different way. Everything reverts back to traditional Part A on Medicare when it comes to hospice.
Okay.
But those are things that we look at because I don't care what age somebody is, what kind of coverage they have. Something is always going to be not covered when it comes to cancer. no matter what kind of insurance somebody has.
Really?
You're going to have stuff that is not covered. Or because there's so many things that are not medical.
What do you mean by that? Like
your gas back and forth to treatments.
Oh, I see what you're saying. Yeah.
Yeah. There's things that people don't even think about that are completely non-medical that are not covered by your insurance. You don't think about that treatment or that gas back and forth to daily radiation treatments.
And loss of work.
Loss of work. If you have a spouse, their loss of work. If you have a 2-week hospital stay and your spouse is there with you in the hospital, their food for the week. Because even if they're, you're in the hospital, so you got food. I mean, granted, not good, but you got hospital food.
It's something.
It's something. But if you've got a loved one that's there taking care of you, everything that they're having to do, their loss of work, your loss of work. Say you have a surgery and you have a volleyball-sized tumor removed from your abdomen like my husband did. He comes out of there. He's a lot smaller than he was when he went in. We had to buy the man new clothes.
That's a good problem to have, but
but it was not one that we expected. Yeah. So, because he went in looking like he was 9 months pregnant, came out with a flat stomach. Yeah. So it was like, oh, okay, well, we have to buy you a whole lot smaller clothes because your pants don't fit anymore. Yeah. So it's things like that you don't even think about. Yeah. But then when you have radiation for 7 weeks and you have to go every day, gas is expensive. Yeah. Say you have to travel for a second opinion somewhere. That travel's not covered.
If you have to go out of town for something, now you're paying for a hotel.
Yeah. You may have experimental treatment that's not covered. If you are on the healthcare.gov plans, you're going to have a tremendous amount out of pocket for cost. Yeah. Because a lot of things are not going to be covered there. Prescription cost. Because there's a lot of oral chemo meds that are given these days. So I don't care what age somebody is. I don't want somebody having to spend 5 years climbing out of debt like we did. So I help protect against that because that was something that we went through.
Yeah. And again, it's all planning and having the foresight to see what could happen in the future and being prepared for it. Yeah.
And it's even about protecting, like with families, protecting your kids. Yeah. Because you can get family coverage that even covers your children.
Gotcha.
Which is not something we ever want to think about, but it happens every day.
Yeah. Yeah. No one wants to get their affairs in order because it's kind of morbid, right? But boy, does that save a whole lot of headache down the road. Yeah.
And when the younger you are when you get it, it locks in on price.
Right.
So you have that savings on the front end. So the policy that we've had for 5 years has never had an increase. And we'll have that policy. And now there's even one, I'm fixing to get a second policy probably, that will return the premium if you don't have a diagnosis.
Really? Okay. So it's a refund.
Yeah. And it can do 20 years. So for us that are in our 40s, we get a policy now that when we're going towards Medicare, if we don't have a cancer diagnosis, get that return of premium, turn that back around and fund an annuity for our long-term care. And you lock that price in now and have a $75,000 policy. Then in the event that you ever do have a diagnosis, here's a check.
It goes to it. Yeah.
Yeah.
And
it's just a check for here's your money. Yeah. And it goes anywhere from $5,000 up to $75,000.
Oh wow. Y'all need to call Angela for real. Just because it's so much. It's so many different angles and different layers to the insurance. My goodness.
And it's about protecting your assets and protecting your bottom line because you don't want to have to pay all of this money out in the event that something happens.
I mean, it's sad that something unexpected can bankrupt you.
Absolutely.
It is sad.
And medical bankruptcy is one of the biggest things in our country.
I mean, my credit's toasted because of it. I'm not going to lie. Yeah. I'm straight up on you. And I don't mean to make this a political debate either. It just is what it is. And it's been reality for years and years and years and years, decades. And it's unfortunate.
It is.
It's unfortunate.
Yeah, they're trying to fix things, and it seems like the more things try to get fixed, so I don't know, it's going off kilter. But
yeah, this fixed, but this broke because of it, right?
It's like they tried to correct too much.
Overcorrection.
There's a lot of overcorrection with things.
Well, Angela, before we head off here, is there anything we're missing? There's one last little message you'd like to send everybody in terms of why they absolutely need to speak to you.
Yes. So, my one thing that I make sure I tell everyone is that no matter who you're working with for your insurance, no matter where you are in your journey, whether you're at the beginning of it, you're in the middle of it, wherever you are, make sure whoever you're working with is somebody that you can trust.
Yeah.
Because this is somebody that you're going to be walking through stuff with. Like if they're a good agent, they're not somebody that's going to enroll you and run. They're somebody that's going to walk with you through these things. So make sure that it's somebody that you know, that you like, and you can trust them. Because
trust. Hello, sales 101 there, but not to make it salesy. But trust. It's so important.
Because if you can't trust the person who's handling your health insurance,
oh God, yeah,
like they can really mess somebody up.
Yeah,
and
where's their accountability lie? Who's the one getting punished for all this? Who's the one taking all the hits for this? It's the customer.
The customer. Yeah. I have been trying to help a sweet, sweet couple this week untangle all of the mess that has been created by someone else. And it was a situation where a spouse met with one, and that is one thing. If you're ever working with somebody, you actually need to either at least have talked to them, or it's not that, my spouse enrolled me into everything. Oh, no, they need to actually speak to that person. There are certain things that you can't just do. Like I can't just enroll my husband into plans. He has to actually sign for stuff, even though I'm his wife and am his agent. He still has to sign for stuff.
Yeah.
Yeah, my mom and dad even say, just sign. No. Like you have to actually sign it. Yeah. So that is not, unless somebody has power of attorney, you cannot sign for somebody else's stuff.
Which is a good thing. It's protecting you.
It should be. But that's not what occurred in this situation. There have been where even as of right now, it even seems like an agent just even signed things without even knowledge. Just even going through these people's mail with them. I mean, I've met with him now 3 times, just trying to, one, help them untangle everything that's been done to figure out what has happened from December to now. And I mean, we've had all kind of mail, but just make sure you can trust the person because they can really mess things up for you.
Yeah. Well, I'm here to tell everyone watching and listening, if you trust me, you trust her. If you trust me, you know me, or you like the show, then you trust Angela, just in proxy, because she is outstanding. I've known her for a few years now. In things that we're not touching on, but we will have you back on this show because
Absolutely.
I want Angela Kidd, Miss DeSoto County on the show because y'all have no idea how involved she is, which adds to that layer of credibility and trust that you can have in her. I want you back on because what I just learned is you're currently, as we record this, the vice president for the Southaven Rotary, soon to be president. When you become president, come back on.
Absolutely.
And then we're going to talk community, DeSoto-wide, all the different chambers that you're a part of, all the different nonprofits that you help. And it is amazing. And I just bring all of that up because Angela is a high character person. I can promise you that.
Yes. And we were also DeSoto's best 2 years running now. Congratulations.
Yes. And big thanks to BNI Hernando. We call them ourselves Mid-South Partners. So please, let's shine on our BNI chapter.
Absolutely.
BNI Mid-South Partners. We meet every Tuesday, 8 a.m. up on 51 in Star Landing at the, is it the Northwest
Realtors Association?
It's free to visit. Come say hello every Tuesday, 8 a.m. We would love to see you there. And then also being in the BNI sphere adds to that level of trust and credibility because we're all in it help each other out.
Yep.
But you do amazing things for the community too, Angela. I think the world of you, and we are going to have you back on and talk community stuff when you become president. When is this rollover happening?
July 1st.
July.
Yep.
July 1st, the new president
Yes,
of the Southaven Rotary. You guys just had, you guys meaning the Rotary, had this huge fundraiser that's going to be now a perennial thing. What was it called?
It is the Crawfish Countdown.
Crawfish Countdown.
We revived it after about a 9-year hiatus the last time they had it.
And it was at the new Agri Center.
Yep. Out on Star Landing. Yeah.
So that's Nesbitt, technically, right?
Yeah, I think so. Yeah, that's technically Nesbitt.
Raised thousands of dollars for all kinds of different things that we'll get into. But thanks again for hanging out, Angela.
Well, thanks for having me.
This is a BNI 1-to-1 too.
Absolutely.
Throw it in the app. I've just recently rejoined BNI. My app's not working still. So,
I got you.
So, again, one last time, AngelaKidInsurance.com, Kid with 2 Ds, 662-339-8133. Go to our beautiful office at 8830 Center Street, Suite 1, Southaven, Mississippi. If you're heading north on Airways, take a right on State Line. It's before you hit the park. It's right there on the right, before you hit the pond. If you see the pond, you've passed it.
Yes,
all right. Turn around and go back. Angela's your go-to for all insurance needs, I promise you. So thanks again, Miss Angela, and
thanks for having me.
You got it, and thank you to the ones watching and listening. This is the Real Hernando podcast. We are on Apple, Spotify, YouTube, Facebook, Instagram, and TikTok. You didn't realize how hip this guy was, right? And spread the word, share a link. Follow a page, comment on a post. All of it is just hugely helpful to this podcast, because if you help this podcast, you're helping people like Angela. It's full circle. You're helping everyone by just engaging on social media. It's huge. So to those watching and listening again, thank you and have a great day.